Now it's time for On Point, where we speak to experts to delve deeper into the biggest news stories in the spotlight right now. The year is winding down and we're set to enter the coldest time of the year in South Korea. Due to winds that blow in from Siberia, daytime highs can sometimes struggle to reach even -10 degrees Celsius. And at night it can get even worse, can't it? The mercury known to plunge to -20 or more, perhaps, when you add in the wind chill factor. Since we're still deeply in the midst of this COVID-19 pandemic, many people, especially the elderly, are concerned about how they can best protect their health over the winter season.
Well, this year we have the Delta and Omicron variants of COVID, as well as the regular flu to keep in mind. But, well, what are some of the best ways that we can protect ourselves and our families as we enter the double whammy of a brutally cold midwinter and the COVID-19 surge? For this, the more we connect to Professor Yu Byung-wook from the International Healthcare Center at Suncheon University Seoul Hospital. Welcome, Doctor. Lovely to have you with us. And well, first of all, what are some of the most common ailments that people suffer from over the winter, and how would you suggest that we protect ourselves as easily and as effectively as possible?
Well, in general, before COVID era, the condition is with the flu, influenza. Influenza first target, we have to protect it. Yes, there are various options, but usually we do the vaccination. The secondly is coldness itself. Whenever our body temperatures go down, our immunity is black down, easy to expose to the pneumonia, any other upper respiratory infection like the common colds. So how we can protect some of the disease in the winter season? First, we can have the flu vaccination and protect yourself well against the coldness. So wear the gloves and the mufflers and keep your body will be the better. And drink a cup of warm tea to hydrate it, and also icing and the icing ground that people can fall down to help the broken. So this is a common the disease that can be happen in the winter season before COVID era.
Yeah, and a lot of people are labeling this season in particular the winter twindemic, with health professionals fearing there's going to be this massive influx of patients with either the flu or COVID-19. Can you tell us which particular age and high-risk groups are especially susceptible to falling ill to these viruses over the winter? And I was also wondering if you could answer this as well. Is it possible to have both the flu and COVID-19 at the same time?
Well, absolutely. I can answer first of the co-infected from the COVID virus in influenza virus together. Whenever whose immunity is very low, can be exposed to any virus. So whenever you expose the virus, you have opportunity to get the virus to invade your human being cell. So this time we are worried about the twindemic, but fortunately many people are following the influenza vaccination. But at the same time, we wear masks in our lives. That's why there are less chance of the transmitting influenza virus than before. But anyway, twindemic condition can be happen for the more than 60 years aged people and critically ill person who has a chronic lung disease like a COPD and asthmatic condition, previously who had infect like the tuberculosis, which means for vulnerable about the respiratory systems disease, at the same time person with a diabetes and a heart disease, circulatory disease who are generally ill person and less than 6 years old and more than 75 years old can be targeted with influenza. Probably we done already for these people having the COVID-19 vaccination, but the younger people we're still waiting for that opportunity to have the COVID vaccine.
And Professor, now over 80% of adults in South Korea are fully vaccinated against COVID-19 after having 2, and in some cases 3 shots of the vaccine. And well, in that position, it might be easy to assume that you're fully protected. But then, would you still recommend getting the flu jab to these kind of people?
Well, absolutely. Today is probably the most coldest day of this year. Usually, coldness is coming. Flu influenza vaccine is coming together from the Siberia and probably already goes around in Korean Peninsula. So actually, I got it influenza vaccination late of September because I'm a medical professional should serve the patient. My parents as well, I recommend having shot middle of October. I did the third shot last Monday. My parents had the third shot for COVID yesterday. Why we have to protect it all? Because still the one way to protect against influenza as well to COVID-19, vaccination is the first line we have to do. And then we do our best to protect our health from the virus. But anyway, some people ask me, so doc, even I'm young, I need the flu vaccination? Yes, you must. Why? Because you will be fine with the influenza, but you can be a host, can transmit your lovely family, your lovely children, and your adorable, your parents can be the fatal. So I hopefully the people got it influenza vaccination, which is very safe, more than 40 years experience. If you have an influenza vaccination, you agree to the shield and protect to not only yourself, you will help to your family and your colleagues and your communities.
Yeah, most of my family this season have gotten the flu shot. There's less trepidation about the flu vaccine than there are about these new COVID-19 vaccines, of course, and having the flu myself a couple of times, I know how miserable that can make you. Before we let you go, Professor, from this weekend then, we've been reporting on it, the South Korean government is bringing back these stringent COVID-related social distancing guidelines and restrictions on business operating hours because of this surge in cases. In your opinion, do you think these measures actually help stem the spread, especially as we hear that this Omicron variant may very well be much more transmissible than Delta?
Well, first of all, I'm really feel sorry about the small, medium-sized enterprise owner and so who are running in the small-sized restaurant and the cafe. Probably the hit and the downs their business. I'm really sorry about it. But now, even we have more than 80%, nearly 90% vaccinated, but Delta variant is characters, and Omicron probably will be the dominant variant soon. So there are the way of better to having time for us, especially for the medical profession and health authority, to measure out the death rate. And now hospital is really full to see the ICU and with the patient with the COVID-19. We need the time to handle this moment. So I believe this the tight, strict measure. Yes, for the many people are suffering with this, but we live together with this, with the COVID-19, because now winter season just begun, and probably the COVID-19 cases probably more than now. So I'm really sorry about some people get the big damage with this, but so there are no way to better inevitable decision to go to the little more tight restriction, probably help to spread COVID-19, but probably it will not to hold it 100%, but anyway, we have the time to managing of this crisis, especially in the hospital.
We appreciate your insights today, Professor. Thank you so much for joining us.
Thank you for having me.